Hi, my name is Sonia Menning, licensed massage therapist. I'm making these videos just to show some of my clients and anyone else who's interested in what I do for self-care. I know that right now is a time where a lot of massage therapist offices are closed, spas are closed, and I know that everybody out there has their aches and pains and sometimes chronic pain. So I wanted to show you some of the self-care techniques that are beneficial for in between your sessions or while you're not able to get a massage. You can definitely do some self-massage. One of the most common areas that we get, that we really love to have massaged and that gets really sore is our upper trap muscles. These again, from being forward all the time, these get really, really tight back here for some people, most people. Some of the different things that you can do will be first to kind of just warm up the tissue. So we're just gonna press on it. So I want you to take all your fingers and reach back kind of as far as they go. And what you're gonna be doing is you're gonna be going back here like this and holding up, and then just pressure, dig in and then pull forward. So I'm starting with my first position. I've got it here. I'm digging in and I'm slowly pulling forward. Kind of holding it, hanging out. Ooh, and I found some good spot right in here that I'll work on later. Glide forward. If you find a trigger point, an area that's like super tender, hang out there for a while. Breathe. Relax your shoulder. Wait until that area kind of melts like butter and you can't feel the pain anymore. All right, so we can come back, pinch, pull forward. Or we can pinch and just hang out. Okay. Then you can kind of do some other pincer compressions with your trap. So we're just going to kind of use our thumb and our four fingers, and we're just going to kind of start with. I'm going to start up here. So I'm not into the scalings. I'm right at the trap, right here. That's my upper trap. And you have other muscles deeper to the trap that might be sore too, but let's start with the trap. So I'm just gonna kind of come through here, just like this, and I'm gonna kind of pull back on it. So my thumb is under here. You know, you can roll it forward, but let's also roll it back. So just kind of put that pressure there. It hurts, it's sore. It's a good therapeutic sore. But I'm just gonna kind of push my thumb a little bit back. Like we're unfolding it a little bit. Then I move down. You can see. I like to kind of move my head. Ooh, I got a scaling in here. I'm kind of hooking onto a scaling that wants to be pinned and stretched. See that one? Tight. It's a middle scaling. And then I'm going to come back out. Bring it all the way out, as long as you can grasp it, all the way to the chromium process. There's a little V in here. It can come all the way out to that. So just come through and pinch, roll back, roll forward. You can pinch and turn. Ooh. Pull forward. And let's go up to the neck. I'm gonna turn around so it might be easier, but what I'm gonna be doing is I'm putting my sides, let's say the spine is right here. I'm putting my fingers on the sides of it. The places that feel really good to be worked on are when you can get closest to the bone where the muscles attach. Those are going to be usually pretty sore, and when we release those, it really helps the whole muscle out. So if we can move, if you see my spot, my vertebrae are right here. What I'm going to do is I'm going to start down here, and I've got either hands on the sides of the vertebrae, right? And I'm just going to pinch down and pull out. And right here I kind of got stuck because I got tight muscles in here. So I'm just going to hold that for a little bit. Breathe till they release. And then I'll move up. I'm pinching. Now right here, my splenius cervicis muscle is really tight. So I'm just gonna kind of hold this for a while. I'm right on the side of my vertebrae. And I'm pushing down right now. I'm just really trying to release those. And as I come through, I kind of flip over them and pull forward. Come up a little bit and push in. Ugh, very tender. I'm kind of like pushing, I'm pulling all the tissue away from the spine. I'm pulling it away from the spine. You can do that all the way down your back or on somebody else. When I do massage, it's like pulling it away from the spine. Just like that. Okay, now we're gonna get into the suboccipital muscles. Those are these muscles back in here. They attach on to those first vertebrae, and they come up and they attach on to the skull. These muscles get so tender because when we're looking forward like this or have poor posture like this, if the top two vertebrae aren't positioned properly, holding your head in place, if you're coming down like this, these muscles back in here, our suboccipital muscles, get really tight, and they're like holding on to 10 pounds. Our head weighs about 10 pounds on average. What we're gonna do is come through and find that ridge. We all have a ridge all the way up here, and I'm just applying pressure. Ooh, it's tender. I found a really good one right in here. So this one, I have a trigger point in here, and right now it's referring all the way up to my eye. So I'm going to hold pressure here, and then I'll release it and hold pressure to here. And as it starts to release, I can actually feel that first pain referral that went into my eye. It's not in my eye anymore. It's more local where I'm pushing. And as the tissue softens, the pain releases, and then I can move on. So with your thumbs, really get those areas. You can do it with your fingertips, spread outward, really get that. Suboccipitals get tight on kids, especially when they're looking down at their tablets and things like that, or their video games. So this is something you should really try to encourage with your kids too. And these anterior neck muscles. All right, so the next one I'm going to go on to is more just overall body self-massage techniques.